The HIV epidemic has been a national health crisis for more than 2 decades. The Southern Tier AIDS Program, or STAP, began in 1984 and provides comprehensive and caring services to the community. Their outreach programs provide individualized support and advocacy to those living with HIV/AIDS and hepatitis C, and their prevention, education, and needle exchange efforts help people protect themselves from infection and reduce the likelihood that infected individuals will spread the disease to others.
It's sort of naive on my part to imagine that we can go anywhere and get it and spread our message. And we work hard at breaking down barriers. Our mandate and mission, as dictated by our original founders 20 years ago, is that we seek to provide community-based person-to-person services that are both prevention and supportive. But we have also a lot of folks who HIV is just one of the many issues they've got to deal with on their plate. They're living in poverty. Maybe they've got addiction issues, so they've got to go into treatment for that. Perhaps they have no place to live. Perhaps their kids have not got food. So we cover the entire gamut of all those services. We are their primary service provider for all of that. And our role then is to help the individual in whatever ways they need. We had a person come in a couple of years ago who went for a test because he was trying to get life insurance. He's a contractor. He had no idea he was HIV positive until he had this test. He'd probably been positive for 10 or 15 years. And that's the kind of person who, because he doesn't perceive himself to be in a risk group, knew nothing about the virus. He knew nothing about treatment. He knew nothing about how he should take care of himself. He knew nothing about how to find a physician. Those are the folks, I mean, everybody needs our help, but those are the folks where you really sit down and think, wow, what would he do without an organization like ours? He wouldn't have the first clue about where to go and how to get services. We are known as being the most vocal rural program of our kind in the state. And I say that in the sense that when we take a look at our region, that includes Elmira, Ithaca, Cortland, Binghamton, Oneonta, and Cooperstown. When we compare ourselves to other regions, we have a very small urban population. Folks living in rural areas are afraid oftentimes. They're afraid for their neighbors to know because they don't know how they're going to react. Rural communities are, you know, classically everybody knows everybody's business. So if you're somebody who's HIV positive living in Grand Gorge or Margaretville or Dryden or Spencer, you will go to the local pharmacy and the likelihood is the person behind the counter is going to know you or know your family or know your parents or know your kids. You don't necessarily want that person to be privy to your personal information that you're on meds for HIV. So I feel that it's important that I make sure that our legislators, our policymakers, and our funders understand that AIDS and HIV is as much a rural program as it is a rural problem as much as it is an urban problem, that it's just not in the cities that people are living with HIV and AIDS.
The AIDS Ride for Life goes a long way in supporting STAP's efforts. HIV/AIDS organizations are in a constant struggle for funding and are obligated to honor the restrictions and requirements established by their funders. An event like the AIDS Ride brings in much needed supplemental funding, allowing the organization the freedom to spend the money where they feel the need is greatest.
We have about $1.9 million in funding, and as time goes on, we need to rely less on government funding because that is not increasing anymore as it did in the early days of the epidemic. We are working with the largest population we've ever worked with, and there's a number of reasons for that. First of all, people are living longer, and that's great, but that also means there's greater needs that they have as they live longer. But the number of cases continues to rise. New York State is still the epicenter of the epidemic. And upstate New York, if we were to chop off the city and Long Island, would still be 10th in the country in number of cases. So there's sort of a perception that the issue is not as important as it used to be. I think of it as being off the media radar screen. But for us, as an AIDS service organization, the issues are, and the need is more compelling than ever before. AIDS Ride for Life is the major fundraiser for the Ithaca office. And what that means is that last year the ride raised $102,000. Our goal was $100,000. The year before we'd only raised $40,000. So it's a huge leap of faith that this ride would come together and bring people back, some of whom had not been there the year before, and bring the entire community together to support our work here in Ithaca. The $102,000 that we brought in from this past year's ride means a huge amount in terms of our ability to continue to provide services here. So our programming gets directly funded through this. Our ability to provide services in the region is funded through this ride. It is the largest proportion of the money that comes in directly to this office.
Corporate donations and rider fees are used to cover the expenses of the event itself. This is absolutely vital. All too often, large percentages of charitable donations are needed to cover overhead. The AIDS Ride for Life, through the support of local businesses, is committed to keeping event costs as low as possible. This allows for rider pledges to directly benefit staff services, and absolutely every penny raised by this event stays here at home. Corporate sponsorship does much more than support the event and the organization. It is a way for local businesses to demonstrate their community support. Radio publicity for the event highlights these businesses as caring leaders in the community, creating a visible and meaningful way to express compassion and support for people living with HIV/AIDS.